Dr. McGaha, thank you for joining us here on Health Connection. Our topic is community health. How healthy are we? And you work in the area of population health. What is population health?
And thanks for letting me be here, Paul. Population health is very important, and it's sort of like a physician looking at an individual tree versus the forest. I'm looking at the entire forest, looking at what's ailing the forest and the population. Is it obesity? Is it tobacco smoke use? Is it other things? And in doing so, we can look kind of big picture and then mind that down to the individual level. And in doing so, we can plan on looking at the factors like that and how they impact the individual and how we can prevent those things from happening.
I'm going to read this question so I get titles correctly.
Okay.
You and Dr. David Lakey, colleague here, he's the former commissioner of the Department of State Health Services. He's now senior VP here at UT Health Northeast of Population Health. You two are working to identify and find solutions for poor health outcomes. How did this initiative come about?
Well, Dr. Lakey was the Commissioner of Health for 8 years. Before then, as you know, he was an infectious disease physician here at UT Health Northeast. Great person, very scholarly individual. I worked for him when he was here, and then I worked with him when I was at the health department. We both worked together. I was in Tyler, he was there, and when we were doing that, we learned a lot about the health of the state. He looked at the statewide health status. I looked at the 35 counties primarily in East Texas. And over a span of 8 years, we evaluated what's going on in East Texas and found some really interesting facts about that, in that though East Texas is great, I've lived here for 30 years and love the people, we are among the least healthy part of the state.
Well, yeah, absolutely. Let me segue into that question.
Okay.
Health data is collected from all over the state of Texas, and as you just said, Northeast Texas looks particularly bad. Our health outcomes here in some cases are the worst in the state. Why?
That's a good question. That's a question that we need to answer. We have some of the answers, but we need to mine down deeper. If you look at East Texas, we smoke more, we are more overweight, and our diets aren't as good as they could be, and we don't exercise as much as we possibly could. And if you look at all those together and combined, they lead to higher rates of emphysema or lung disease. They lead to higher rates of lung cancer. They lead to higher rates of cardiovascular disease or heart disease and stroke. And I think in East Texas, we smoke to a greater degree. We are overweight more than a lot of the other parts of the state. So those risk factors for disease occur greater in East Texas among individuals, and therefore our disease rates are higher. Now why is that? People make choices, and there's various lifestyles. We have a very rural region in which people are more isolated, and they can't get access to that preventive care like some parts of the state. It's kind of a complicated picture, but it's based on some of those risk factors, greater to a higher degree here, and if you put them all together in individuals and populations, it leads to the higher rates of high blood pressure, stroke, heart disease, cancer, and some other things. Diabetes is among the higher ones too.
Well, I think you just may have just answered this question. What are some of the most significant health issues facing Northeast Texans, and what can they do to fix it?
Well, if you look at some data that we're coming out with, we'll be coming out with a report in the next couple of weeks, and we'll be sharing that with you when it comes out. We're looking at the Northeast Texas area as if it were a state, the 51st state, and comparing that area to the rest of Texas and to the United States in rank order as if it was the 51st state. If you look at some of that data, rates of lung cancer are very high here. They're the highest in the state of Texas for sure. Interestingly, our rates of colon cancer or gastrointestinal cancer are higher here too. We have very high rates of lung disease related to tobacco use, and we also have very high rates of cardiovascular disease, heart attacks, and stroke here, all related to some of those risk factors that I referenced earlier. Those are some of the main drivers. In addition, interestingly, and not as related to some of these parameters, we have relatively higher suicide rates here in Northeast Texas, and our rates of motor vehicle crashes and the deaths resulting from those are even higher in the East Texas area. So what we want to do, and I know what Dr. Lakey wants to do, and we appreciate all the support of UT Health Northeast and the community, is mine down deeper into the why We have some reasoning that I just mentioned to you as to why, but what can we do to mine down deeper as to the why? And secondly, most importantly, what can be done? How can we link up with other healthcare providers, other institutions, communities to move the needle toward better health in East Texas?
There is a survey in the field now. It's been sent out to the community here in Northeast Texas, disseminated in a variety of ways. Let's talk about that survey, why people should complete it and return it.
Thanks for asking. I think it's real important. We're surveying individuals in a 28 county that are 17 years old or older. And we want to take a fresh look at what's on their mind related to health. What are the health risks that they're facing now? What are the shortfalls in the healthcare system that they're facing? What they feel like are some of the shortfalls in their accessibility to health? What are some reasons why they don't exercise? What are some reasons why they keep smoking, et cetera? We just want to take a new snapshot of health status through this survey and look at trends, and then based on that, and we hope we get a lot of people to participate. We're hoping for several thousand. Based on those findings, we can frame an intervention perhaps, working with partners in Northeast Texas to try to, again, help move the needle toward better health in the Northeast Texas area.
So once this data is collected, what are you going to do with it and how will it help?
The data will be very useful, and the time people spent on finishing the 42 question survey, which will take about 11 minutes on average, not a long time, and it will be available online and it is available online and in hard copy. We'll look at the numbers, we'll look at the answers to those questions, we will look at trends, how people are feeling in East Texas, we'll look at what they identify as the top issues that they're concerned with. Is it lack of insurance? Is it lack of walking trails? Is it lack of nutritious food, lack of access to mental health care, dental care, or health care in general? We'll couple that with the health status report that's coming out in coming weeks, and then we'll look at the main issues that bubble out of that or emerge out of that. And most importantly, that next step will be to look at, based on what we found with that information after we crunch the numbers and everything, is what are some interventions that we can hopefully work together with other partners and other healthcare providers in the Northeast Texas area? What are some things that we can do to change that status that we're having here in East Texas, to improve health status here in Texas? And again, one of the things that will be coming online in January is the new School of Community and Rural Health. And we have some new professors, some new PhDs and others that will be coming on board that will help us analyze that data and, again, most importantly, apply that data. How can we use that data to improve the health of our fellow East Texans?
You and Dr. Lakey, you're working together. What goals do you have for UT Health Northeast population health initiatives?
Well, I think, we appreciate certainly the foresight for the institution here to have a population health unit. I think we're the only health science center in the Northeast Texas area, so I think we're poised to, working with a lot of other partners, look at the area, look at the region, which is a great region, the most densely populated rural area in the state of Texas, which leads to several different dynamics. Looking at what's happening now, as we mentioned earlier, with surveys, with various plans, and looking at ways that we can all work together to improve the health of people in East Texas. Dr. Lakey is committed statewide to doing that. We're not the only health science center doing these surveys and things like that. He's having every health science center in the state, including MD Anderson, develop these plans. He'll be putting together our plan, which is due at the end of this year, with all the other University of Texas Health Science Centers and MD Anderson, and he'll be developing a statewide plan that he can use at that level, and we'll be using our plan here in East Texas to help hopefully provide valuable information and information that other communities can use for grant writing, for resources that can be pulled into the area to help us really do good studies on Northeast Texas and with the goal of improving health.
So you and Dr. Lakey and the other professionals here will know the results of the survey, and you
Yes.
will be informed. But what about the general public? Where do we find out where we stand?
Well, we will finish the survey, as I mentioned, toward mid-September. We'll be evaluating the data, and it will be finalized no later than December 1st. But even before then, that survey and the results will be posted online, and individuals can come to our website and find the results. And they are welcome to use it for grant writing purposes, to use it for general informative purposes. But that will be on our website at uthealthnortheast.org. It will have a lot of useful information. Eventually, the data report that I mentioned earlier about Northeast Texas will be posted there. That will contain about 100 pages of data about Northeast Texas. There'll be great references for people, again, that were writing grants, just wanting to know the health status of their county among the 28 counties. And that will be up and will be refreshed as needed as we move forward.
Very well. Doctor, thank you for your time.
Okay, thank you, Paul. Appreciate it.